I'm going back to to me, the crux of the whole budget is the medical. You take everything else, that's what's driving the 7%. So I want to really kind of understand it. So as I look at your chart that you had in your presentation, you've got the $1.8 million of budget. As I look at the right-hand side, the way I'm interpreting is it's going up from $5.4 million to $7.3 million for this fiscal year. Does that include the funding of the reserve, to building up the reserve, because we've depleted it? So we're actually maybe only going to spend $6 million and another $1.3 million to build up the reserve. So could we look at, if we had to try to minimize, keeping a lower number for the reserve? Is that an option on the table? Have we looked at that, or am I not interpreting it right?
No, it's a great question. And currently in this fiscal year, we're anticipating $8.6 million in medical expenses overall. And that will include medical, prescription, and dental, which is about $100,000, a small amount for dental. $8.6 million for everything. We had made the assumption in October of last year when we were budgeting on that chart, and I'm just looking for the chart, that we would have approximately $1.2 million as part of that. The 5.4 is a depressed number because we counted on the reserve. The claims were so high, we ran through the reserve and we were going into the red, which meant that all of that money was gone. It wasn't a true reserve in the sense of a reserve. Before these very difficult years, the district enjoyed some good years where at the end of the year, the claims did not reach what they thought it would. So those years, they were actually able to take down the operating budget and not increase it. They didn't put the money away for a rainy day because we're trying to live year to year. So we are just getting the dollars to pay the medical claims for next year. If we stayed with HealthNet, the 8.6 would be a 14% increase, which comes out to be about $9.8 million for health care for this district next year. Added.
Can I stop for a minute? That's why I'm kind of confused. Because if we're self-funded, why is HealthNet saying it's going to be a 14% increase? Because isn't the self-funded, I mean, that we pay them as they go?
Yeah, self-funded means that we are the insurance company, that every medical claim that comes through, we pay for. But HealthNet has contracts with doctors and hospitals that gets us a preferred rate. So the doctor may charge $100, but HealthNet said, if you're in our network, you're only going to get paid $60. So HealthNet will look at all of our people and estimate, based on the claims you've had, this is how much it's going to take care of the health benefits of your people. And you need to have a contract with the healthcare provider to get through the system. That's why you need one of the big players at the table, because they have all the leverage with the hospitals and the doctors. And HealthNet charges an administration fee to do that. So we look at paying our medical, and we're looking at getting a new vendor and looking at what is the administration fee, what is their rate, because if they get better discounts with the hospitals and doctors, we can get that discount back for our claims. What you don't see as part of the overall medical is that our employees, retirees contribute about $1.2 million to the overall cost. This is only what the Board of Education puts in the budget. And so when we have a bad year, they pay their set cost that we set at the beginning. The risk and self-insured is all on the board. So if we have a good year, we are able to take that money and put it away. If we have a bad year, we have to figure out how to manage that. And those are the ups and downs of self-insured. Over time, self-insured tends to save 3 to 5%, but you have to be ready for the difficult times. I think if you have nothing to do Monday night, you might be interested. There's some interesting proposals coming forward that the board's going to hear about that may help us look at a different way that we can look at this that will be positive for the district.
That's the regular board meeting on Monday night.
7:30 here.